started, and welcome everybody back to the first meeting, post-pandemic meeting of the Elder Care Committee in person. Meeting of the Elder Care Committee. Nice to see everyone. Some people have changed since I saw you last, and others have remained the same, which is also good. So, I'm gonna ask our council if she would call the roll.
Well, Madam Chairwoman, Ms. McLaughlin,
Here.
Ricard, Feston.
Here.
Chapman.
Here.
Demiso.
Here.
Cunningham. Here. Demalowitz. Moriello.
Here.
And Whalen. Here. 8 present, Madam Chairwoman.
Thank you very much. I'm going to welcome all of our guests this evening, and in the form of staff as well as legislators and department heads. We look forward to hearing from you. And the first order of business is approval of previous minutes. And
Second.
motion by Mr.
It's been 3 years, Preston.
Beston, right? And
Bob Beston. Block.
He's new here.
no, I'm a new one, so, charge it to my head, not to my heart, as they say. And second by Ms. Cunningham. As I said, I haven't seen people in 2 years, except on screen. And some of us hide behind the screen, so.
Little rusty, but he'll go.
But we'll get it together. Thank you so much. Is we moved in second, all those in favor?
Aye.
Any opposed? Thank you so much. I'm gonna ask, our council if she will continue with the committee, agenda by reading the next item on the agenda.
Sure, Madam Chairwoman. Item 2 is authorizing an agreement with Core Tactics Healthcare Consulting, Inc. regarding nurse consulting services for Shaker Place Rehabilitation and Nursing Center. Mr. Blackie is here this evening.
Thank you, Mrs. Slackey, for being here. We look forward to hearing from you.
Good evening, everyone. This is a continuation of an agreement we had with Core Tactics, a renewal of their contract for a period of 12 months. They're usually one-year agreements for the same exact cost of $150,000 per year. Core Tactics is responsible for the education of our nursing staff, specifically to the quality indicators that guide CMS guidelines for our 5-star rating in quality, which we still maintain right now, 5-star quality. Even though staffing stars are down and other stars are down because of difficulty of getting personnel, but the quality is still 5 stars, and Amy Lee, the owner of the company who does service our account, is primarily responsible for that.
Any questions? Mrs. Slackey? If not, yes.
I'd just like to comment, I disagree with you on that, Larry. I think that the reason why we got 5 stars is because of the quality of what that our employees do and the hard work and dedication that they have. That's what makes the big difference, is the dedication that those employees have out there. A lot of them, as you know, are long-term employees.
Without a doubt.
You know,
That is totally true, and I can't take away anything from that statement.
Thank you. But
She
thank you
educates
for
and
your hard
works with
work.
the staff.
In your leadership.
She educates and works with the staff, but it wasn't for their sincerity and caring of our residents. Clearly, we would not have a 5-star rated nursing home.
Well, you know what, I was here when we didn't, and I was here when they tried to close it. And I was here when the county executive took 150 positions out of the budget. When I was chair of finance, and this legislature put them back in. So, we've been down that road, it's been a long road, and I think it's fantastic that we have a 5-star facility, which I thought we'd always would have, that's why we never close it.
Well, thank
Ms.
you.
Whalen? Did you have your hand up?
No,
Oh.
I did not, sorry.
Okay. Didn't want to mention it if you did. If there's no other questions, can I get a motion? Motion by Mr. Camisco, second by Mr. Beston. All those in favor?
Aye.
Any opposed? Thank you very much. The next item?
Item 3 is amending resolution number 453 for 2021 regarding the Advanced Training Initiative.
Mrs. Slackey?
This is a contract that we have with our association, Leading Age New York. It's part of the Advanced Training Initiative of New York State Department of Health, where we received the grant in excess of $200,000. $50,000 was donated to the education of the staff using their modules that were approved by the state. And this is for a date change only. We weren't able to get all of the education to the personnel in the time allotted. under this agreement, so we need to extend the dates of the agreement, but the dollar amount is not going to change.
Any questions? Ms. Williams?
Move it.
Oh, I have a question about pre-pandemic levels with contracts like this versus post-pandemic levels. Is this still the same? Like, this is my first term as a county legislator. I'm just wondering if these have
Well, it's a lot
increased
more
or-
difficult, if this is the, if I'm answering your question correctly, let me, if I didn't, let me know. It's a lot more difficult to get the staff off the units, to educate them during the pandemic and the staffing crisis that we're in now, to get all the education in that's mandated under this program.
So like this, for instance, was something that was done pre-pandemic, or like,
No, we actually got the Advanced Training Initiative money during the pandemic.
okay,
And we entered into the contract during the pandemic. But there was a target date that it's supposed to be completed by. We were able to get an extension from the New York State Department of Health, because we couldn't get all the education in from those modules.
so I've been appointed as a member of the healthcare subcommittee for the relief funds. So I'm just sort of wondering, you know, how to reconcile like something like this versus what we should do with the second tranche of the money for healthcare. Do you think we need to supplement things like this with
Well,
more
clearly,
training, or do we have enough training for dementia care, pain management, infection control? You know, I'm just trying to figure out how it all pieces together.
the hardest part, if any funding would be needed that is not part of this program, it would be to allow staff during their off hours to be trained versus doing this while they're working, meaning these programs are done or conducted during the work shift. So if I'm a certified nursing assistant, I'm working 3 p.m. to 11 p.m. We're gonna be running a program from 7 to 8. They have to leave their unit. They're still responsible for their residents, and then go through the educational program, then go back to the unit, versus have them come in, it would have to be voluntarily, but I'm sure many staff would come in, let's say, from when they're not working, and we could provide the same educational program when they don't have the responsibility of caring for residents, and of course, be reimbursed for that.
So how many hours roughly is that?
Well, these programs, depending upon the program, pain management is a 6-hour program for each person. So that means every single nursing staff member who goes through the program has to participate for 6 hours each. And it's a 6-part program, we do an hour each time. That's why we just couldn't get it done in the allotted amount of days.
Okay, well, thank you, sorry.
Okay.
Oh, I'm
No, that's
sorry,
okay.
Madam Chairwoman, did you call on me to ask you the question?
Yes, I did.
So,
I did.
okay, good, sorry.
Just one quick question. Is the state mandated?
Well, the answer is yes, because we received this money from the New York State Department of Health because of, through the Advanced Training Initiative, which is given to those nursing homes that have good retention and improvement policies and practices. So we qualified, we received the grant, which was over $200,000. They give you modules that you could choose from, and those modules are mandated as part of this program.
Okay.
So you do have good compliance, it's just a difficult thing to manage,
Yeah, to get everyone in.
given the staffing that you do, staffing levels. And
Right.
can we just get in terms of the staffing level, what is the staffing ratio at this point in time?
Right now, staff to resident is probably around 2.6 hours a day per resident. That's all staff, RNs, LPNs, CNAs, around 2.7, 2.6, 2.7.
And what is the average for the state?
Well, the new mandate from the state is 3.5,
3.5.
3.5.
Okay. Thank you so much. Are there any other questions?
I just have a follow-up question. So are you saying that we aren't able to meet the state mandate, quite possibly because we have like these training
Well, it has nothing to
seminars?
do with the training,
Oh.
the supply is just not meeting the demand,
Oh, okay. But
or the
then-
mandate.
But then when these folks are pulled off of like the ratio to patient care, and they have to go off on a
Oh, it's still
continuing
counted.
medical education, that's still counted as
Yeah.
like the staff
It's
to
hours
patient.
worked, they're in the building, we count those hours
But
there.
they're not working with a patient, they're working on a training, right? So it doesn't take away their it doesn't reduce that state mandated ratio?
No,
So your 2.6 hours includes their training,
correct.
where they're really not like facing off with patients, actually.
One could argue, yes, that's true, but the hours are calculated through our Cronus system, time card system. It goes through what's called a PBJ report. Those PBJ reports are submitted up to CMS, and it's based on hours worked. So if you have a 40-hour work week, and we pay you for 7 hours as an example, where the 7 hours are directly related to caring for a resident or in education, all 7 hours are calculated and counted.
Thank you.
Thank you. There's no other questions, can I get a motion? Ms. Cunningham? Can I get a second, Mr. Canisso? All those in favor?
Aye.
Any opposed? Thank you very much.
Okay,
Motion
thank
passes.
you, thank you.
Thank you, Mr. Starkey.
Item 4 is authorizing an agreement with Access Transit, Inc. regarding transportation services for eligible seniors.
Commissioner, so good to see you.
Nice to see all of you. We understand my 11 things here are standing between you and your supper. Sorry.
We got quite a bit.
We can group them all, I mean, they're all just renewals, agreements.
Yeah, good idea.
Huh?
I like it.
Yeah, some are different, some are
So
the
as I
same.
understand it, a lot of these items that you have deal with congregate meals. And these are recurring items from year to year. What year is it?
Good, that'll work.
Okay, so did you want to give us an overview?
Well, do you want to go by them one by one?
We're on number 4.
Pardon?
We're on number 4.
You're moving to number 4? Yes, all right. So you're
Is that
authorizing
right?
the agreement with Access Transit, all right. We're just asking you to approve that contract amount. So those rides include, taxis and wheelchair and walkers and bus trips and those kinds of things.
Did that service go, again, I'm asking everything related to the pandemic in terms of, were people going out as much?
No, they weren't.
They weren't, yeah. And
No, they weren't.
So,
But they're moving now.
they're- everybody's anxious to get out and be pulling back in once the weather changes. Does anybody have any questions about that, item number 4? If not, can I get a motion, Mr. Vespi? Second, Ms. Cunningham? All those in favor?
Aye.
Any opposed? Thank you very much, motion passes. Number 5.
Item 5 is authorizing agreements with the New York State Office for the Aging and the Albany County Department of Social Services regarding the New York Connects Expansion and Enhancement Program.
Yes, so this is really just asking you to authorize the MOU that we have with DSS regarding New York Connects. It's nothing different than before, but
You say is something different?
no, it isn't.
Okay.
It's what we always do.
And can you explain what New York Connects is?
New York Connects is the point of entry. So let's say you've got a problem, you have a senior problem. Maybe it's really just something simple as transportation, that you're concerned about getting somebody, getting your mother to the doctor. And so you call and you get your mother, and first place you call is New York Connects. And then they assess, what the problems are. And maybe the problem is more than that. Maybe she's gonna need a congregate meal. Maybe she's gonna need really a home-delivered meal because she's frail. So you go through New York Connects, and then those referrals go to the proper, or the proper organization that we need to do it. So, if it's a home delivered meal, you know, an assessment takes place, and, that all happens because we, you know, we contract with DSS to do that for us.
Okay.
Yeah.
Thank
So it's a single point of entry, you know, that's all of that.
Mm-hmm.
Any other questions?
Make a motion, Chair.
Motion by Mr. Bessie, second
Second.
by Mr. Donald. All those in favor?
Aye.
Aye.
Come right in, Mr. Ricard.
Thank you. Contract didn't want to make a typo, but this is for the back.
Motion passes. Number 6,
Item 6 is authorizing an agreement with LifePath regarding adult day services for seniors.
Okay, we have, we're just looking to, this is a renewal, for the adult daycare, that's our social adult daycare. They have 2 sites, one on Colton Avenue and one over in Cohoes. And, we're just asking to be able to renew it.
what kind of, again, is that picking back up, or?
Yes.
Okay.
Yes.
Any questions?
And the Colvin Avenue one is actually a new site, so it's, you know, it's pretty modernized and people are enjoying it, and so, that one is really picking up. once
What's
they
the
got
average
them.
weekly attendance?
I would have to ask them, I don't know the answer to that, but I know that, it certainly has increased, I think Cohoes has probably remained the same. But I think that they're close to up to 20 people that are coming in there, that's a lot of folks.
Do we provide transportation through this, or is it drop-in?
Yes, if they require it, yeah,
But people can also just,
get dropped off,
yeah.
Yeah.
And they,
and there's a meal provided at it,
okay.
you know, and activities and, you know, daycare.
Can I get a motion?
Motion to approve?
Ms. Whalen,
Second.
second by Ms. Cunningham. All those in favor?
Aye.
Any opposed? Thank you so much. Motion carries. Number 7, please.
Item 7 is authorizing an agreement with Cornell Cooperative Extension regarding dietitian services.
Well, our dietitian is, part-time. We've saved money for the county by making that move, so I'm really happy about that. And we've gotten great feedback about the dietitian. I mean, the providers love her. She's easy to work with. You know, if something needs to be corrected, I mean, she's certainly on top of it, but, all the feedback has been really great. And, you know, in our office, we love working with her. She's really been terrific, so she's a great team member and part-time, and we're really happy to have her. I will say to you though now, so mark it down, next year we're probably gonna have to give her a raise. But, so far this year, we're at status quo.
Now, does she help in terms of planning, when I think about all the congregate meals, does she help in outlining?
She helps plan them, do the meal planning. She makes sure that, she's there to make sure that the guidance is being followed that comes out of the Older Americans Act regarding, nutritional, services, and make sure that things are being met, yeah.
Now, do you do an annual or any kind, semi-annual or whatever, evaluation of meals with resident or people who receive the meals?
Oh, do we do, well, we do surveys with people, yeah, we do. And we monitor we monitor every year the provider so that we know exactly what they're doing and, whether or not they're cutting the mustard, but, yeah.
So individual survey for individual sites and the individual provider.
Yes,
And what kind of ratings do they get? I mean, I would imagine if they're not doing good, they won't stay on. But What kind of
Well,
comments?
you know, I mean, it depends on what you're rating, you know, I mean, you send the person out to do the monitor, you know, the dietitian goes out to do the monitor, she's, you know, she's critical, there are things she has to look at, are they doing the right serving size, do they have the right components that make up the meal? You know, you're getting the meal, and you might say, wow, this is great, I'm getting a lot of food, you know, I mean, just because somebody isn't paying attention, so you're talking about two different things. The person receiving the meal might just absolutely love what they're getting, but on the other end, they might not be, you know, the person providing the meal might not be following the rules. And that's, you know, that's a different issue.
Right, and so I'm more concerned, well, I'm concerned about both, but
Yeah.
my question more pertains to the person who's actually receiving the meal. And, because sometimes food is not good. Do you hear that? And the food, at the same time as food is excellent, you hear that. But do you hear both sides? Do you have a survey of that?
We do have a survey of that. I think people are less inclined, although we have gotten calls where, you know, somebody has said, we really had a lousy meal. This is really a lousy meal. And, you know, and then we've talked to the provider about, you know, what went wrong, or, you know, I mean, you can't please everybody. You know, I mean, that's the truth of it, you can't please everybody.
Can you do that in your own house?
That's right.
Yes, Mr. Demolo, it's all his hand, and then Ms. Whalen.
Thank you, Deb, good to see you. Touching on, Madam Chair, with the food, I have 45 years in the food business, wrote many specs for the state of New York, in probably all the counties in the state. What are the specs for these foods? Because it sounds like there's no continuity. Is this,
There is-
individual?
There's continuity, you know, you have guidance that comes out of the Older Americans Act.
Right, but they
And
don't
that-
tell you to buy a grade A green bean, a grade B green bean, you know, or just a commercial run. That's where you got the problem what Carolyn's talking about, because people are, you got the one organization, I don't know, pick one, who's buying a good quality food, and the other one who's looking at the bottom line and buying the grade B and C product. And so the people who are getting the A's in the choice meats and the quality products are happy, but the people who are getting the lower grade products.
I believe our dietitian is on top of that.
Well, here's the thing.
However, I will follow up on
And
that,
I'd be
because
more than
that's
happy-
that's a good, you know, that's a good point, I come out of the food business myself, so.
Well, you know, I'd be more than happy to help you with this, and I'm saving you a lot of money, believe me, from doing it.
Well,
But,
I appreciate the offer, thank you.
But we should have specs set, you know, and, so that it's continuity with whoever you buy your chickens from, Life Path or Green Island or Cohoes, should all have the same quality product.
Well, and I believe that to be true. I don't believe that is not happening. I think the only discrepancy there would be regarding kosher and halal meals.
Right.
That would be the
right,
only
right.
discrepancy. But you know, I mean, the dietitian has often said to providers, you know, you can get X, Y, and Z at such a place, and it will cost you less money. You know, depends on where they shop, it depends on how they're able to procure their food.
Well, that's something else.
You know, are they going to Price Chopper, are they going to Restaurant Depot? I don't know.
Well, that's something else I'm an expert in, seeing I was a marketing specialist with Cisco for 5 years. Actually started them with their business here in Albany and corporately, and there is a big difference.
Yeah.
You know, and it depends on what your spec is. If you would just send me what their spec is and what they're buying, I'd be more than happy to mark it up for you. And do we have a policy where all these outside vendors purchase off the same, or they're all individually? Last I remember,
I
been a
think
long
they're
time
all
since-
individual, I don't,
Yeah,
I
so-
think Patrick, you would know that.
Each one of the providers.
Or
says they're-
it's all individually, yeah.
So is there any way to make sure that they're all buying the same quality product now?
Well,
And you gotta put that in the
I
contract?
don't know that you could really,
basically,
back that.
that's left up to each of the providers.
So we just tell the providers, you're gonna give us a meal for $2.25, I don't care how you do it, get there. That's
Well,
all we're doing.
We don't actually tell the provider that they have to do it for RFP it out, and then
That's
they
right.
tell us what they're doing.
What they can do.
And then they send in their
There
menus.
you go, you know, why you got problems.
Well, we vote on these providers, don't we?
And we vote on the providers, we
But
send
we
out the
see them.
RFP, yeah.
We vote on we voted
Yeah,
on
but
like
this-
Ally B's Kitchen and, you
Yeah,
know,
but
Peter
that's
Young's
just appointing
cafeteria.
them, that's not, we're getting more, we're taking the next step. We're getting a little more deeper on what the actual products that they're buying. And that's the reason why you got problems with quality, because there's no oversight. All we're saying is.
I know, but I think you're also assuming that there's a
I don't even know who
problem.
they are, I can do it for $2.
I think you're assuming there's a
I
problem with the
didn't hear there were
quality.
problems.
We're not getting that.
And that wasn't the point of my question,
Yeah.
that there was a problem. But I'm more concerned, I wanted to make sure people are satisfied. And, because we're not helping the, health and the quality of life for people if they're taking a meal and they're not eating. That's my
right, that's
only
right, yeah.
concern here.
Mhm.
Ms. Whalen.
So I guess I have some questions, like, is there a problem? I didn't realize there was a problem with these providers and
No.
we have a dietitian, I mean, it seems like people are pretty happy in these congregate meal situations and are going and eating the food, right? So are
They
there,
are,
is there
I
an
mean,
overwhelming
again,
amount of
When
complaints?
there's a problem, we get on it right away. There might be a discrepancy on,
And then also, I would imagine that these providers aren't making a huge profit on whatever it is we're giving them. I remember seeing a list, I can see it in my mind, like a list of providers and like the amounts of money we're giving them, so.
they're not. And the other thing that,
I
you know,
don't know
that I'll
why.
also lay at your feet is that we're getting more and more requests to go places, you know, people, they do an RFP, they say, here's how many meals we're gonna get you. You know, we're lucky so far, everybody is staying on track with their
Right.
money.
Like, I just don't really, I think it's like like all of a sudden this has gone into like, you know, is Ally B's Kitchen giving someone bad green beans? I don't think that that's like right or something that we should be implying at this table because
Who
it doesn't.
said that?
Well, it's like all of a sudden we're talking about qualities of green beans and, you know,
Everybody
whether.
eats green beans, not just Ally B, she's not the only one serving Ally B.
He was talking about green beans, like I didn't know that
No,
this
you
was.
said that.
No, just for
Or
clarification.
the quality of the
No, I don't think that's what he was.
Well, for clarification, there's 5 different qualities of green beans you can buy.
Right,
That's
are
my
we-
point.
are
My
we
point
using-
is, either
are
you're
we
gonna buy a
using
good
a-
one, a
So
green
you're
egg.
telling,
and-
okay.
Is there a bad?
Good, better, and
Let's
best.
not get that specific, that's not the kind of discussion we were having here.
Okay.
If we were not getting into the business of evaluating the individual service providers. And I don't want anybody leaving this room saying that Ally B's had bad green beans.
Right, I don't either, that's what I'm afraid of.
But you're the only one mentioned her, nobody else did.
Well, there's like
So I'm just saying that,
Well, I have-
so let's clear that up. Nobody,
Peter-
you're not
or-
evaluating the
Or
providers.
Peter Young, is Peter Young another provider? Like, I remember the
Peter Young
list.
is a provider
Yeah, I
of
remember
home
that.
delivered meals, yes.
Okay, can I get a motion?
I'll make a motion, Madam Chair.
Second.
Motion by Ms. Ricard, second by Ms. Cunningham for the green bean. So, let's, all those in favor?
Aye.
Thank you very much, motion passes.
State
We're
of
gonna,
direction, serve 3 meals a day for a buck.
that was number
They're
7.
not-
Now, number 8, 9, and 10, are, again, are congregate meal contracts. They're-
No,
are-
number 9 is,
Home delivered, I'm sorry. But, the 8, 9, and 10 are home delivered meals.
Can we bundle them?
That's what we're gonna do right now. That was my
Motion to
point.
bundle them?
I'll second it.
All those in favor to bundle?
Aye.
Thank you. So, Ms. Vitano?
so you threw me off. What did you do here?
8, 9, and 10.
8, 9, and 10, okay, so Life Path and Peter Young and Ravina all do home delivered meals for us. I will tell you, home delivered meals by, are all staying at the status quo, so we're not, everybody's staying within their contract right now. I don't see a big increase either way, so, we're just looking for you to authorize what we've always done.
Just one quick question. Why do you use 3 different providers?
Well, because you have you have a big county,
Okay,
so
Well, that's
you
the
have
question.
zones where, you know, so Ravina Projects has a certain area that they do the home delivered meals. Life Path goes, you know, in another area. Colony does another area. So, you know, people are zoned, we don't send, you know, we wouldn't send one person down to Ravenna to take care of a person. That's why we have the zones.
Okay.
Any other questions?
Who's doing Albany, do you know? Who does Albany?
Depends on what part of Albany. Life Path does a lot of Albany, home delivered you're talking about.
Yeah, home delivery.
Yeah, Life Path does a lot of home delivered. Ravenna does some of.
No, I mean in Albany, around St. Peter's Hospital. Who does
Around
that?
St. Peter's Hospital. If they're kosher, it gets done by Jewish Family Services. Not kosher, which is most, gets done by Life Path, I think, takes care of that area. Yeah.
And they do all that cooking out of Colvin Ave?
No, they do that cooking out of their commissary, which is down, off of Morton Avenue, I forget.
Warren Street.
At the,
Is that Warren
Warren.
Street?
Warren Street.
Yeah, down by the Lincoln Park.
You know, it's over where Charlie Muller had his area. I
I'm
can't
having
remember
brain
the
freeze,
street,
But it's in the building.
but that's their,
Right
that's
there.
their commissary.
South Campus.
Yeah, South
I know what
Campus.
you mean. Okay,
Yeah.
yeah. Thank you.
Thank you. So for 8, 9, and 10, can we get a motion?
Motion.
Second.
Motion by Ms. Cunningham, second by Ms. Whalen. All those in favor?
Aye.
The motion's carried. Thank you so much. And I think we have 11, 12, and 13 are also a congregate meal.
They're the congregate
And
meals.
it's the different zones that you talked about. I think that would be pertain to different areas. Is that right?
Right, so the department is
Can we get
focused
a
on,
motion to group them?
Motion to group.
Second.
All those in favor?
Aye.
Thank you.
so those are our congregate meal sites that are around the county. As I said, we're getting more requests to do congregate meals in other spots. We just opened 2 new ones, New Scotland area. We've got another one going, that we're just opening up in Van Allen Apartments, which is Glenmont. So we just got the permission to do that one. So, you know, we're focused on and making sure that the policies and the regulations are being followed.
Yeah, I
That's one
noticed that
thing.
there's a variety, and they're all over the city as well, so I was pleased to see different neighborhoods are covered.
We're covered, yeah,
Yeah.
we're covered.
Mr. Demolo.
Do you have a minimum requirement for someone to come in and say, we'd like to have congregate meals here?
Yeah, because, I mean, it doesn't make sense to me. We have a problem with one site right now, where on a Friday, they're really busy. They probably have 20, 25 people who come to eat. On Monday, they got 3. Does it make sense to continue with that, we're discussing that now, for 3 people? No, because in my opinion, I think it's foolhardy, because you could say to those 3 people, you know what? Drive a little further and you can go over same day and get a meal here.
What if they don't have a car?
That would be sad, but true. Then we would get them transportation. We never say no to anybody, and anybody can show up at a congregate meal. So, you can
Oh, so
live.
you can go anywhere.
By the way, you can live in Schenectady and you can show up in Green Island and say, I'm here to eat. And we take that on because you cannot say no to anybody. And that's just the way it is. So, but I mean, I think we give very good coverage. I think we're providing a good meal, and programming that goes with it. I think that we're doing all right with it.
Did I just ask her a follow-up
Mr.
question?
O'Connor?
Just a quick, something you just said. So if somebody shows up from Schenectady and goes to Green Island, like you alluded
Yeah.
to, so would you do a charge back to Schenectady County, or how does that work?
No.
You can't do that? Okay.
No, and if you had asked me this last week, I would not have been able to answer your question.
Okay.
But I did follow up on it because, because I wanted to know if there was reciprocity.
Yeah.
And there is not, at least not for congregate meals, because you have to take whoever comes through your door.
Okay.
So, I only found that out this week, so.
So is that a federal requirement? or-
Yes, it comes out of the Older Americans Act. again.
Okay, all right,
So
thank
we
you.
don't have a quality problem, they're coming from Schenectady.
Good point, green beans are coming
There
from
you
there,
go.
right?
Can we get a motion if there's no other questions?
Thanks to the
Motion.
Ms. Cunningham, Mr. Camisco, thank you so much. All those in favor?
Aye.
Any opposed? Thank you so much. Item, motion
That's fine.
are carried. Item number 14.
Item 14 is amending the 2022 Department for Aging budget for mobile office.
So we're just asking you to transfer money from one line to another. That's really all that request is about.
Real quick question. This is grant money that's being used?
This money is our unmet need money that we're
Okay.
gonna be using.
This is a grant that's coming from the state. You want to be able to get it. Is that,
Yeah,
Okay.
any other
Motion
questions?
move.
and we need to utilize it by the end of the year.
Nope, spend it. They're gonna lose it.
This is the wrong one?
Motion move.
Second.
by Mr. Dustin, thank you so much. All those in favor?
Aye.
Thank motion carried. Can I get a motion to, Mr. Camisco? Mr. Ricard, thank you so much. Thank you all for your time.
Thank you.